Hello, my name is Mary Albert, and I'm an implementation specialist with Brown& Brown. We are the broker on behalf of your group. And what that means for you is that you have an account management team that is here for you pre-enrollment, post-enrollment. If you have any questions throughout this upcoming coverage period, you do have an account management team that's dedicated to you. Now, today's presentation will be, I will provide an overview of the benefits that are being offered to you so that you feel confident in making your elections for this upcoming coverage period. Now, this coverage period will begin January 1st, 2024 and run throughout the duration of next year. Now, this is your annual open enrollment time. Your enrollment is passive. And what that means is if you currently have benefits with your employer, they will be rolling over into next year's coverage period. However, this is a real good time to go into Employee Navigator, and I'll give you those dates as to when your window will be open. But it's a real good time of year to get into Employee Navigator to review the benefits that you currently have elected, because this is your chance to make any changes if needed. Your enrollment window is December 4th and will run through December 15th. Now, this page just includes some great terminology you will hear me using today. If you need to reference it, they can be found here in your benefit guide. Now, there are some things that are changing, and we are going to go ahead and zoom in and take a look. So some of the things that are changing is you're still going to have that medical coverage through Florida Blue. One will be switching to HMO, and the other one is going to be a PPO. There's been some real great changes on the one plan, on both plans. In fact, one is staying the same, which is a great plan in place. The other one, the deductible has been lowered. And so I'm excited to share that page when we get to the medical page. One, like I said, is a PPO. The other is an HMO. Now, if you are going to be signing up, this kind of reviews the eligibility, as well as if you're adding dependents onto your plan. Now, you did hear me mention the date of December 15th. That is going to be when your enrollment window closes. So it's going to be real important to either make your elections or changes prior to that date. Once December 15th rolls around, you will be sealed or locked in throughout this upcoming coverage period. However, if you do experience a qualifying life event, and some of those are listed on this page, marriage, divorce, birth or adoption of a child, please reach out to your HR team within 30 days of that event to see if coverage can be changed. Now, your medical plan is being offered to you through Florida Blue. I highly recommend that you create a member portal with Florida Blue, and you can do so by logging on to this website we've listed here for you. What are the benefits? By creating a member portal, all your information is housed right there. And I know specifically with Florida Blue, once you have that member portal created, it welcomes you by name. It shows you highlights of the doctor's office visits that you've had thus far, what you've spent on those visits. It's such a nice way to file all your information into one place. In addition, to get those replacement ID cards, there's a lot of good added resources built into the specific Florida Blue member portal. How to find those in-network providers and facilities, that's going to be the #1 way to maximize your plans, which I will go over. All of that information can be housed right there. There are tremendous benefits. I can't wait to share this Better You Strides program that you can sign up for by being a Florida Blue member. And I will be going over that with you. Virtual visits, you'll have access to virtual visits through Teladoc. This nurse line is a really great number to have on hand, because if you are seeking out a second opinion or just want to ask a question, you would have contact and speak or able to contact a nurse 24 hours a day, 7 days a week, throughout calling that number, as well as some additional supports. Down here you can see there's some well-being supports as well. This cost comparison tool is always a great thing to have on hand if you are planning some type of procedure or a special visit to the doctors, you can have an idea of what that would cost you in advance. Now, I love to highlight this Blue 365. In fact, the website is blue365deals.com. This is a huge discount program that is available to Florida Blue members for free. Take a look at that website that I just mentioned to see if there's anything you can take advantage of. Now, this does cover some of the things that I just mentioned in regards to virtual care, urgent care centers. It's real important to make sure you are always, if you do seek out that service, make sure you are going to an in-network facility, as well as an emergency room. Of course, that's going to be at a higher cost, but it is good to know now, hopefully when you're feeling well, to create that roadmap as to where you would go, where are those in-network facilities prior to when you potentially could need that service. Now, this is that teledoc, this virtual care that you do have available to you. Teledoc, I don't know if anyone listening to this has taken advantage of virtual care. If you're not feeling good, it's the middle of the night, you're traveling, you just don't want to go to a doctor's office, you could potentially take advantage of virtual care. If doctor deems it or a licensed health professional deems it medically necessary, they can even write you a prescription through this service. Now, I'm going to provide everyone the steps into register. I wouldn't wait until you might need this service to register, because that might be a difficult time to fumble through the registration if you're not feeling your best. I would say get this set up now so that if you need to utilize this particular service, you'll have it ready to go. If you want to access this, you can access it via the app, by logging onto your computer, or even by a phone call. Now, this is that Better You Strides embedded program that you have available to you if you sign up as a Florida Blue member. Now, if you take a minute just to kind of see the different rewards, if you're signing up, each time you go and have that wellness exam, every time you go and have different types of wellness services, you can earn rewards, and you can earn, hopefully that grabbed your attention, up to $100 in rewards. The way to register is listed down here. Now, if you're a current employee and you're listening to this recording prior to December 31st, 2023, and you haven't signed up for this, just by signing up, you will get $30 as a reward. And here's even better news. That's per member on your medical plan. So that's coming in right in time before Christmas. So I encourage you just to set that account up so that you can take advantage of those rewards. That's great stuff. So these are your two medical plans being offered to you through Florida Blue. This first one here is now going to be an HMO. This is your core plan. And then of course, this blue option is your PPO plan. I'm going to go through some of the similarities that both of these plans offer. Now, if you go to your wellness exam, which includes any annual physical, that would include your annual blood work, any preventative screening that is appropriate for your age and gender would be covered at 100% when staying in network. And I'm going to highlight those networks for you in just a minute. I would advise when you make that appointment to use that terminology, your annual physical, so that it's coded correctly. Now, do know if you go into the doctors for that annual physical, if you start asking if your shoulder's hurting or your knee, it would be coded as an office visit. So these are for your annual checkups. And I would encourage members minimally to make sure they're having that done. So when making a decision on which plan would be best for you, I encourage you to frame the question, what do your current benefits look like? What's working, perhaps what's not working? And do you have any procedures or treatments scheduled for this upcoming coverage period? By thinking of that question will help guide you into making the best plan choice for yourself or you and your family. So I mentioned the network's name. It's real important to know the network name. So for example, on this first plan, you'll know up here, Blue Care is the name of your network. So if you're seeking out a provider, of course, that member portal is going to be your best friend in doing so. If you're calling providers, you always want to make sure you ask, are you in network with Blue Care? You'll notice that if you do step out of the network, you will not have coverage. Now this plan over here, the network's name is different. It's Blue Options. You do have coverage out of network. I do want to explain how that works in just a moment. But the first thing I like to start with is when you look at these pages, it really breaks down into two ways that you would pay for a service. The first thing I want to go over is when you see the word deductible plus coinsurance. So when you go to, for example, I'll use this first plan as an example, let's say the emergency room. If you go to an in-network facility, you are going to pay a negotiated, contracted, reduced rate for that service. Anytime, and on the second plan, you'll see you have, if you happen to go to a hospital, it's going to run the same way. You're going to pay a reduced negotiated contracted rate because those facilities or those providers have a contract with Florida Blue. Anytime you make a payment on a service that has the deductible label next to it, it all tracks to the same place. That money goes into a bucket, and that is called your deductible bucket. And this is wonderful news because this has lowered significantly for this upcoming coverage period. I mean, this deductible is quite low. So on this first plan, if you, and some folks never hit their deductible, if you on this first plan hit that $500 deductible, you'll note the second one as well. These are employee only. If you've met your deductible, you knock that wall down, you then go on to phase two. Phase two is coinsurance. Coinsurance is a cost sharing between you and the insurance company. So for example, I'll use the second plan as an example. If you've hit your deductible as employee only, I use that as my example, and have to seek out other services that say deductible plus coinsurance. Now there's many services that are covered on these plans. We like to take a snippet so you understand how your plan works. If you've met your deductible and you seek out a service that has that deductible plus coinsurance, you will still be offered that negotiated contracted rate for that service. However, now you are only on the second plan paying 20% of that bill. Florida Blue pays 80%. And on this first plan, you only pay 50% of that bill. Florida Blue pays 50%. So you never want to have to hit your deductible, but do know when you enter that second phase, your costs are significantly lowered. Now, the third phase, worst case scenario, is your out-of-pocket maximum. And that is listed here, different on each plan. Do know that if you are out of pocket that amount and you've hit it while staying in network, health covered services thereafter when staying in network would be covered at 100%. That is how anything that says deductible plus coinsurance tracks. Now, if you don't see deductible plus coinsurance, you would see something called a copay. And as you can see, there's different copays for different services on both of these plans. I've just highlighted a few as an example. Now, a copay is a fixed flat dollar amount that you are expected to pay at the time of service when you seek out that type of care. Some people, it's a fixed flat dollar amount that you're expected to pay. I like to say, imagine it like a ticket to go back to see the doctor. Some people love copayments because it allows them to know exactly what they're going to pay for that service. Anytime you make a copayment, it does not track towards your deductible. However, it does go into that out-of-pocket maximum bucket. So you are getting that money, credit for spending that money, and it does track into that out-of-pocket maximum. Now, I do want to talk about the name of your networks, this second plan. It is a PPO, which means you have in-network Blue options and out-of-network Blue options. But I'd like to take a minute just to explain the difference. If you step out of the Blue Options network, which is a very large national network, Many providers participate in that. If you step out of that network, those buckets of money, so for example, your deductible bucket, your out-of-pocket maximum bucket, are separate. The out-of-pocket starts over at 0. It is quite difficult to fill your in-network and your out-of-network bucket. Okay. In addition, those out-of-network physicians and facilities do not have that negotiated contracted rate with Florida Blue. So oftentimes you would spend or pay more for those services. However, I always say if it's in your medical best interest to seek an out-of-network doctor, you would have that coverage over here. However, we like to explain that there is a cost associated with that. Now, you do have prescription drug coverage on both plans. If you go onto that Florida Blue member page and there's a pharmacy tab, if you have a prescription that you receive, type in the name of that medication, it would place it into a tier. Depending on what tier that medication falls under would determine what you would be responsible for paying when picking up that prescription. Now, if it's in your best interest to have a generic prescription, talk to your doctor. That is one way to lower those out-of-pocket expenses. In addition, if you're on that monthly medication, anything written in a 90-day supply is another opportunity to save money. So this may have grabbed your attention because I can tell that ACI values their employees. These are both excellent plans. This first plan is absorbed 100% by your employer. The second plan, this Blue Options, which is a phenomenal network, is being absorbed quite a bit by your employer as well. So these are the costs that would come out of your payroll deductions. Now, another way, your company is great. I don't want to skip over this feature because this is wonderful. If you opt out of the medical coverage, for example, you might be on a plan with a spouse, you will receive in your paycheck $300 a month by opting out if you have coverage somewhere else. So very good to know. Now, I did mention that you have prescription drug coverage through your medical plans. Sometimes you might receive a one-off prescription. GoodRx and Single Care could be an opportunity that you could lower those costs if you take advantage of these websites. They are free. The way they work is you type in the name of the medication onto these websites, and it'll show you the different pharmacies that medication is at and the cost associated with picking that prescription up. Oftentimes it lowers the cost. We do like to let you know, though, if you take advantage of GoodRx or Single Care, it does not track towards your out-of-pocket or your deductible, but it could save you money. Now, another thing we like to give members the choice of is different pharmacies have different discount programs for different prescriptions. For years here in Florida, if you had a prescription for an antibiotic, you could go to Publix and get a generic version of it filled for free. So different pharmacies have flat rate discounts for medication. I always say it's your skin in the game. And what I mean by that is when you receive a prescription, it is an opportunity to save money. So by knowing that, is good to know. Now down here, I shared that you have that nurse advice line that you can reach out to 24 hours a day. You have virtual care through Teladoc that you can take advantage of. Your primary care physicians, all of those services are going to be at a lower cost. Now, if you were to seek out urgent care, the most important thing worthy of a highlight here is to make sure you go to an in-network facility. Similar to that Teladoc and having things set up in advance, I would advise to have an idea where those facilities are, even hospitals, so that if you were to seek out that type of care, you would have an idea of where to go. Now, you are being offered dental coverage through Guardian. This is a PPO, which means you have in and out of network coverage. The benefit to going in network is that they're going to offer you those reduced rates. So your network can be, in-network dentist can be found by visiting this website, or you can call your dentist and ask them, are you in network with Guardian? Now, when you seek out preventative care, that would include exams, cleanings, certain x-rays, that would be covered at 100% when staying in network. If you were to need basic or major procedures, you would pay a one-time dental deductible. It's a calendar year deductible. So for example, if you needed a filling, you would pay a one-time per person. It's $150 collectively, no more than for your family. You would pay a $50 deductible, and then whatever that reduced bill is in network, your plan would cover you. The guardian would pay 80% of that allowable charges. You would pay 20%. Now, do know this, and you can see for major procedures, it's a different percentage. You are given an annual maximum benefit of $1,500. And that money is you're not given it, but it's set aside and it's used to cover claims, allowable charges throughout the course of the calendar year. And you do not have to split that with members on your family. That is per person per calendar year. Now, I love this about your plan. You have a rollover benefit. A lot of plans do not have this. You are lucky that this is in your plan. The way a rollover works is, I just mentioned that you have $1,500 of a benefit. Let's say you have to be on the plan for 1 year, but let's say 1 year goes by and you've been to the dentist. You have to go at least one time, file at least one claim, and it has to be less than this $700. And there are years where you might go to the dentist and you don't need that dental benefit. And there might be some years where you go to the dentist that you need more than that benefit. Well, lucky for you that some of that money will roll over. So if you go to the dentist one time, been on this plan for a year, you've used less than $700 of that benefit. If you stay in network, $500 of that money rolls over to your next calendar year. If you go out of network, it's $350, and that gets tacked on to this amount. Now, if you're on this plan for many years and you keep rolling over a little bit of that money, you can have no more rollover than this figure down here, this $1,250. So that is wonderful. A lot of plans don't have that rollover benefit. And just another example of ACI, I'm really honored to present these benefits because I can see that they've absorbed a lot of these costs for you. So these are the premiums that would be reflected in your paycheck. Now you're also being offered vision coverage through Guardian. Specifically, the name of your network is Davis Vision. Now, many months ago at Brown & Brown, we had an eye doctor that came and spoke to us and shared the benefits of having your eyes examined. I didn't know this. By having your eyes examined, they can see more about your overall health than just your vision. They can see if you're pre-diabetic, high cholesterol, high blood pressure, with other list of diseases that they can see by looking at your eye. I'm not a salesperson. There's no benefit to me telling you that. I share that because that is good to know. So I always encourage folks to minimally have their eyes examined for that reason. Now, when staying in that Davis Vision network, if you go in for that eye exam, you're going to pay a flat copay. You are eligible to have an exam every 12 months. So if you schedule your exam for February 1st, you are eligible for that next exam. It will be February 2nd. It's 12 months plus 1 day. If you do need lenses, basic lenses are just a flat copay. Frames, you're going to be given an allowance to shop in network every 24 months, as well as contact lenses. Now, you can't use your eyeglass benefit and your contact lens benefit within the same year, so you'd want to alternate them. But don't forget, you're so lucky to have Florida Blue because you have that blue365deals.com that you can take advantage of for the benefit that you would not be covering using this insurance. Now, if a doctor deems it medically necessary, you would have this benefit covered in full. I do want to take a moment to tell you the difference between in and out of network. These glasses are new. I went in network and had my examination. I had a prescription. I was walking in the mall and went into a Lens Crafters because they were having sales. They were offering discounts, $50 off. Went through all of my things that I needed for these glasses, and it was going to cost over $500. I then asked, is this facility in my network? They were not. Went over to VisionWorks, which happens to be in my network, $133. I share that because sometimes folks think by going to Walmart and Target, that's the best savings. It could be. Always start with your in-network facility because these benefits are quite rich. So to maximize this plan, always start with that in-network facility so you have that to compare. And this is phenomenal. Good news down there because the premiums are quite low on the vision and all of these plans. Now you are being offered short-term disability, and this is going to be through Guardian. Short-term disability is paycheck protection. Heaven forbid you become ill or in an accident and you can't work. This, if it's an eligible claim, the underwriters at Guardian determine that, would pay you 60% of your weekly salary, up to a maximum of $750 a week. You can be on this short-term disability plan for up to 13 weeks. Now, do know if you're new to this coverage and you decide to sign up and you have a claim, the underwriters at Guardian will go back 3 months prior to when you were eligible to see if it's something that was pre-existing or that you were treated for. Now, once you're on this plan for 12 months, there is no look back period. And this is a calculation tool, which also would help be calculated for you through Employee Navigator. But this is based off your salary and off of your information down here. You could just plug in those numbers. Now, long-term disability works very similarly to short-term disability. However, this would go into effect if you're out of work longer. It would start on 90 days. It pays you 60% of your monthly salary to a maximum of $7,500 a month. Now, you can be on long-term disability for up to 2 years if you're disabled and unable to do your own job, or if you're fully disabled and unable to perform the duties of any occupation, you can be on this until up to Social Security age. Now, definitely worthy of a Zoom. Look at that. ACI, Advanced Concept Innovations, is covering and absorbing this benefit for you 100%. This does not cost you anything. That is tremendous. Now, you are also being offered basic life and accidental death and dismemberment coverage through Guardian. This is being covered by your employer, another benefit that they are absorbing in full. So that does not cost you anything. Heaven forbid something happens to you, ACI would pay a benefit of 1 times your salary to someone that you designate as a beneficiary. So I mentioned that Employee Navigator is where you sign up for your benefits and you can't change them during the course of the year unless you have a qualifying life event. However, you can update your beneficiary throughout the course of the year. You can have 1 person as your beneficiary, you can have 3, as long as it totals 100%. It's also a good idea to consider a contingent beneficiary or a secondary beneficiary. Heaven forbid something happens to your primary. This is being absorbed by your employer and does not cost you anything. Now, you're also being given the opportunity to purchase voluntary life insurance or additional life insurance. You can purchase this on yourself as the employee in increments of $10,000. Now, if you're watching this as a new hire, you can add increments of $10,000 until you get to, if you want to, go past this guaranteed issue, which is $150,000, you would be asked to complete evidence of insurability. And that just means it's a medical questionnaire. Now, the most you can have covered on yourself is listed there as well. Now, if you are a current employee and you've declined this in the past, you certainly can add additional or this voluntary life insurance. But if you add it, if you've declined it in the past, you as well would be prompted to complete that medical questionnaire. Now, if you purchase it on yourself, you can purchase it on your spouse. You can do so in increments of $5,000. Same thing is going to be applicable to your spouse if you've declined it in the past with that evidence of insurability. You can also cover your children. There are two different amounts. If you have one child, if you look up here, or if you have three children, it's going to be one premium, and that is going to be per $1,000 of coverage that you've elected. And if you decide to sign up for the voluntary for you or your spouse, there's a calculation tool here, again, per $1,000 of coverage. Now, additional benefits that are being offered to you are going to be brought to you through Colonial Life. All of the previous benefits that I went over are how you would pay the doctor or the dentist or the eye doctor. These benefits would pay you direct. So one of the benefits that are being offered to you through Colonial Life is accident insurance. It depends on if you were to have an accident, depending on what the accident is, this benefit would pay you direct, not the doctor, a lump sum amount, depending again on the accident that you may incur. Another benefit that is being offered to you is this critical illness benefit. Heaven forbid if something is diagnosed, this benefit would pay you direct. And another benefit being offered to you through Colonial Life is medical bridge insurance. One of the things to know on this particular plan is that even if you don't need it, they will give you, they will send you a lump sum amount, and all this more information can be found on Colonial Life, what the amount is, but they pay you a lump sum benefit as a thank you just for going into your free wellness benefit. So that's actually really good to know. Now, I really want to take a moment to highlight this page. These are your key players. All your contacts throughout your upcoming health journey can be found on this page. I'd specifically like to highlight Lauren, your account manager, Brown & Brown. She's a teammate of mine. You're lucky to have her. Lauren is phenomenal. She is here for you. Like I mentioned, if you have questions during your enrollment time, even once enrollment closes or during your health journey, you have her contact information here. Now, some important dates for me to review are the enrollment dates. This is a passive enrollment. So if you want to go into Employee Navigator, it's going to be opening December 4th. And it's going to close December 15th. So if you want to make any changes, you're going to want to make sure you've done so before then. That is your enrollment window. So thank you so much and have a great day.